Greetings, everyone. Welcome again to another mini clinics. This is Stowell Healthcare. You could visit us at stowellhealthcare.com, where you could find information about our company and what we're all about. Again, my name is Emmanuel. I'm your revenue cycle manager, your coach, your revenue cycle instructor, your revenue cycle professor. I'm here to dissect more medical modifiers. We're going to decode them, dissect them, and break them down until we understand them. Today, I present to you some surgical modifiers that is used in the medical billing industry. And if you learn to master these modifiers, you'll become a valuable person in the company that you work for, or in your team, and so forth. Today, before we can, as you know, when we talking about revenue cycle, we're talking about reimbursement, we're talking about optimizing, we are talking about reducing of bad debt, we are talking about reducing denials, getting it right the first time. Because why? Because it costs, on an average, per the expert, not me per se, this is bigger than me. It costs on an average between $25 to $100 to rework a denied claims. Again, it costs on an average between $25 maybe to $200 when you talk about of hospital claims, because hospital claims are more complex and it requires, when I say hospital, I'm talking about inpatient hospital claims or inpatient more complex cases of claims. But on the average, it costs a little bit more to rework the claim once it gets denied, or you may risk of losing the revenue if you don't work the claim on a timely manner. Again, my name is Emmanuel. I'm your revenue cycle administrator, manager, instructor. I'm here to give you some tips on how to alleviate the stress, how to optimize reimbursement for the company that you work for or for your company. Or if you have interest in learning about medical billing, you choose the right platform, where we give you genuine information. We don't just read you the information. We break it down until you understand it. We underline it. We underscore it until it makes sense to you. We put it in a language not to be complex. We put it in the simplest language as possible. And it's my job. It's my responsibility. I've been doing this for over 25 years. I'm here to make it easy for you. And let's get started. Before we get into the modifiers, I'm going to read a couple of things you need to keep in mind. Big Brother is watching. The insurance is watching. The auditor is watching. OIG is watching. CMS is making note of your modifiers. Because how? Because some of these modifiers that we're about to describe here, it break the code to enter and get payment. Without these modifiers, the claim will get denied, it'll get rejected, or you will have to supply medical record to make sense of what you are billing. Let's get started. I will start from I will skip the modifier 58. I'm going to get straight down to modifier 78. Modifier 78, it's unplanned return to the operating room. Next, we have modifier 79, which was in physician billing. We use this quite a bit. Unrelated procedure or service. When we say unrelated to the surgery that was rendered. And then we'll go back to modifier 78. Modifier 78, we say it's either stage or related. So meaning that a patient had let's put a pause. Let's put the brake. Let's hit the brake a little bit. For those of you who are new here or who are new to billing, or coding. The modifiers, it's a 2-digit alphanumeric that gets appended to the claim, that gets added on to the claim. This, if you grab the CMS 1500 form, the professional claim form, you could find this little box in box 24D. There's 3 little boxes there. Those 3 little boxes, that's where the modifier get added. On the UB04, which bill for mostly facility charges, you could find this on box 44 next to the HCPCS. And electronic version of the 837P professional claims, you'll find it. You can add these modifiers in the segment loop on loop 2400. And description to what the modifier is. What does the modifier is really? It's give additional information to the procedure. For instance, it adds additional information, it changes the description, or it could specify it. For instance, when you look at your anatomic body site, we're talking about left, right. So let's say, for instance, if a surgery was done on the left ankle, the surgery was done on the ankle, I will append modifier LT to identify it was done on the left ankle. Or let's say the eyes, 2 eyes, therefore it could either be done 3 ways. It could either done, although I've never seen this done. I've done ophthalmology billing for more than 13 years. I've never seen cataract surgeries rendered bilateral on both eyes all in one session. I've seen it, the patient usually, and Big Brother knows it creates coding rules to say how many times a cataract can be done in the same session. It's funny. But hey, for you to understand this, all these modifiers that are created by the big gurus, they're also laws that we need to abide to know that we are doing them correctly. For instance, big governments such as CMS, Medicare, Medicaid in the United States, they create laws such as NCCI, or short CCI edits, LCD, NCD, PTP, AOC. If you don't know what these are, then you're not ready to use modifiers. And before you start using modifiers, I will highly recommend you look at the OIG website and see how modifiers affected medical providers. And if you're appending modifiers and when the auditor comes, I don't want to see you going hiding behind the door. You need to have the confidence to come in and represent the practice or your organization or the team. If you're not ready to do so, then I highly don't recommend you use these modifiers that we are looking at here. There are laws, stock law, Anti-Kickback, False Claims Act, you need to think about. Notice that on this banner, what I did here, I create the human brain power. In the evolution of AIs or bots, ChatGPT, all sort of artificial intelligence, and in EMR, I heard there is EMRs that can do coding for you. Well, when the auditor comes, the government comes after you, I want to see, are these AIs representative going to represent you with the government? When the government coming back and says, I'm taking 100,000, 200,000 for false claim created by you, or decoding, unbundling charges where you are pending modifiers. And that's when you're going to decide to call Stoller Healthcare to represent you. Again, let's get it from the start. We're going to get it fresh. It's a fresh start. It's a new beginning. This platform is created with you in mind, and this is the kind of things we have in mind. So let's get started. Modifier 58. Example, a procedure where the doctor, it says I did a procedure. This procedure has a global period of 90 days. However, I didn't finish. For you, my treatment plan is to do some of this procedure here. And then I plan to do my next operation. I plan to finish it at a later time. This is what it means, it's stage. The doctor decide, let's finish the surgery at a later time. A different session. We're going to continue this surgery. We're going to append this modifier. It's related to the surgery. It's related to the original surgery that was rendered. This happens in ophthalmology all the time. Let's say, for instance, the doctor decide to do a cataract surgery, for example, and you have a ruptured capsule, and then you finish the case. However, you unable to implant the lens, the IOL. Now, you say, I'm going to leave the patient as a phakic, and then I'm going to follow the patient and or you or another doctor might continue the case. Another doctor might continue the case. Another doctor, you may refer to a retina specialist or a more experienced doctor, or the doctor might decide, I'm going to finish it at a later time. I'm going to take the patient back to the operating room. And this is related to the surgery. And I'm going to finish it at a later time. I stage for the patient to come back at a later time. Next, we gonna do Modifier 78. Modifier 78, which says unplane here, return to the operating room. Yes, the patient needs additional treatment. Yes, the surgery I'm about to do, it's related. For instance, I'm gonna use ophthalmology again. You know, my expertise is ophthalmology, but whether it's orthopedics, cardiology, urology, gastroenterology, all these modifiers mean the same thing. It doesn't matter. Modifier 78, the patient return. You at the end of the cataract, you examine the patient, you find some lens fragment or the lens is dropped. These are all related to the cataract cases, my brothers and sisters. Don't tell me it's unrelated. It is related. Without the initial cataract surgery, patients come within the global period. It is related. Now, next, unrelated procedure or service within the global period. Example, patient had bilateral cataracts on both eyes. Now, doctor operate on the left eye to start. After a month, the eye is healed and patient's ready for the next eye, although cataract cases bear a 90-day global period, right? We understand that. So the next eye, which is the right eye, we're going to append Modifier 79 to that surgery because it's unrelated to the surgery that was done to the left eye to get started. This is where you put the Modifier 79. It's unrelated. Unrelated. Modifier 78, it's services that's rendered where you take the patient to the operating room. I've seen practices where they are using Modifier 78 in the exam room. Not. You take the patient to the OR. You use Modifier 78. So now we have 3 big modifiers that are used in surgical billing and billing throughout the United States. We just decode them and give examples on how to use them. If you need further instructions on how to use them, visit me You can find me on Facebook, Instagram. I'm on YouTube. We have a YouTube channel. Or you could simply visit us at stalwarthealthcare.com. You know, this is what we're here for. This platform is built for you. This is for you in mind. We're going to continue. We're not going to stop. This is not for the imposters. This is for real decoding, medical billing, you know, dissecting it. Just, you know, we getting ready to, you know, to take off here. So this is medical billing at its best. This is not for the imposters. We're going to give you genuine information. We're not going to give you, this is general information, general information. This is not to be for any specific payers. If you have a claim that's denied by a payer and you asking me, oh, I have a billing questions and you're not giving me the payer, well, I can answer you. I only answer payer specific questions. Without you giving me the payer, the patients, and information like this, we can't answer you. Although because of HIPAA laws, we can't. So therefore, you need to call us and sign up for a session. And we will be more than happy to review any claims that you have. And we are your revenue cycle billing company here in Massachusetts. We are US based. And this is what we do all day, every day. This is what we breathe. This is what we eat. And it's our job. And we love it. 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 And we've been doing it for over 25 years. My name is Emmanuel. I'm your revenue cycle manager. This has been one of our little mini clinics on modifiers. And I look forward, if you find this information to be useful, or if you like this video and like sharing that information, don't hold it for just for you. Continue to come to the platform. We continue going to bring you more and more and more revenue cycle information. And thank you. And I look forward to see you till next time. Thank you for all the support, everything that the comments that you've shared, good and bad. I love them. Keep on coming, and I'll continue to bring more of these review, training, info session, whatever you call it. And we're not going to stop. We'll continue to bring them to you. Thank you. Take care. Bye-bye.